following program is suitable for general audience of any age.
Success is not built overnight. It is built by one big decision, one setback, and one breakthrough. Great entrepreneurs aren't just dreamers, they are believers, doers, and builders. And with that thought, welcome to Business Best on Other Derana News channel. This is a voice and a platform where we give entrepreneurs and upcoming businesses to make their mark, and like-minded individuals by you to take a little inspiration from it. And with that thought, we are in conversation with Riza Cassim. Riza Cassim is the CEO of Slim Pharmaceuticals. Welcome to the show, Riza.
Thank you.
We are glad to have you on the show.
Thank you very much.
To begin with, we'll begin with the core. Who is Riza Cassim?
Yeah, it's a good question. So to begin with, I would say it doesn't matter where you come from. What it matters is what you want to achieve in life and where do you want to go. So thank you, Jana, for inviting me today. It's been a great pleasure to me to be here. And in retrospect, I can go through my life story with you. Basically, I started my career in 1994 as a medical delegate in a pharmaceutical company. So if I want to start as beginning, now I'm a CEO at Slim Pharmaceuticals. So by 1994, when I started, it was a medical delegate. It took some time. I gained momentum. I strategically went from A to B, and step by step, I increased myself. I put myself up. I gathered qualifications. I gathered my KOL base. I gathered people. I gathered stakeholders. By 2002, I became to the middle managers. And by 2009, I went to the higher management. As you know, leadership is very lonely. And it was a great run from 2008 to 2023, where I was able to step up the ladder continuously and very profoundly, step by step. And I gathered a lot of higher management qualities and moved forward. In 2023, I had the privilege of joining Slim Pharmaceuticals. It's one of the fastest growing companies in Sri Lanka. We import pharmaceutical and distribute and market here. And I was there for the last 2 years. Subsequently, with the performance, I was being promoted as the CEO in 2025 September. So at the moment, who I am is that. And I come a long way of 31 years of journey.
Like you mentioned, you had 31 years of experience in the whole pharmaceutical industry. Did you always want to go into this industry, or what drove you towards this pharmaceutical industry?
Exactly, that's a very good question. It's one of the most pristine and the noble industry that you can ever work for. Similar to the medicine field, that you are able to look after the patient. This is also something similar, that you are able to give the accessibility of the world-class medications to the patients of Sri Lanka. So it's a passion actually, it's a commitment. And also I always seek knowledge. I want to seek science. So basically a pharmaceutical industry means we sell science. We don't sell product, we sell science. So that gave me the commitment and the passion to help me to continue in this particular field for such a long time. 31 years is a long time.
Yes.
So that really gave me that feeling that I should continue. And also looking at all the lucrativeness and also the scope in the pharma industry, like demand planning, inventory management, getting into You can be a medical service license officer, clinical service license officer, pharmacy license officer. So the scope is immense. So when we started, the scope was very thin. But now itself, the scope is immense. So who really wants to come into the business, this is the field to come in.
Okay. So marketing in pharmaceuticals has both science and strategy. So when you're taking a decision, how do you have the aspects of having a proper decisive decision, or in terms of creativity, how do you take a decision with both the aspects in it?
Yeah, basically when we bring a drug or when a drug is being manufactured, it is manufactured looking at the unmet need of the patient. So you may be having a drug that can control diabetes. You may not have a drug that can stop the mortality rate, that can reduce the mortality rate of a diabetic patients. So it basically is the unmet need of the patients. And with that particular drug development, you have a clinical evidence, you have clinical studies, you are moving forward with clinical studies. Depending on that, depending on the patient pool of particular area, we build up the strategy. So basically, Slim Pharmaceuticals, we work within the boundaries of the compliance.
Okay.
So more ethical company. So what we exactly need is to provide world-class drugs at an affordable price to the patients.
Okay.
That's what I meant.
Okay. So names like AstraZeneca, Pfizer are quite known to us because of the COVID-19 pandemic, right? And these are big names in the pharmaceutical industry, and you have worked with these brands. Can you just tell me your experience with this?
It's amazing. It's amazing. Actually, those companies only made me here.
Okay.
And those are companies, global multinational companies, like the Slim Pharma, work within the boundaries of the compliance and work within the frame of compliance. The same theory applies everywhere. Wherever you go, the pharmaceutical company looks at the unmet need. So one unmet need is the doctor's unmet need, the healthcare professions. The one unmet need can be the unmet need of the patients. So companies like what you mentioned groom me to this level. Their training, their international exposure was immense. And I can still remember, Gina, when it comes to a few years ago, I was able to win international awards in pharmaceuticals, South Asian awards. Then I realized, actually that was one of my turning points, that I realized actually we are also doing very good work in Sri Lanka. And we are also following the Sri Lankan method. And we have been accredited and been champions worldwide and accepted by us. That builds me such a lot of confidence when I join Slim Pharmaceuticals.
Yes. I'd like to congratulate on the awards that you have won. And just to mention, you won the HEMA CEO Award and Country of the Year Honours Award. Yes. So with these awards, I'm sure you have principles that you follow to keep consistency. Can you just name me a few and just speak about it?
Yes. I think basically this particular pharmaceutical industry needs etiquettes.
Okay.
So we work within the etiquettes. And we are globally governed by the anti-bribery and corruption law and the compliance law. So whatever we do, we make the patient first. So that's called the patient centricity. The patient comes first. So with all the experience I have gained and all the multinational I have gained, I always put the patient first. Make the patient centricity first. So that's what we follow. And also work within the etiquettes. And also, if you see Sri Lanka, we also have boundaries. So we work within that boundary.
Yes. So you've led teams from the US, which is the West, Vietnam, which is Asian countries. And I'm sure there's different gaps in the cultural aspect. How did you show your leadership skills from both of these sectors?
Yeah, actually, I was being a part, I was leading them actually.
Okay.
I was being a part of that. And I'll tell you, Sri Lankans are on par with them. We are not below. So what it matters is the commitment. If you see the commitment levels and if you see their dedication towards work, and also they are very sharp and specific. So Sri Lankans are second to none. So we also can be there. That's why we have won several awards.
That's true.
And so while working at Slim, I can feel my particular team is doing brilliantly well. They are so sharp and they're so agile. I can see the enthusiasm. I can see their drive. So I don't think there's a disparity between X and Y and here.
Well, we are in conversation with Riza Cassim, a giant in the pharmaceutical industry. We need to head into a short commercial break, and we will be back with Business Best. We are in conversation with Riza Cassim, the CEO of Slim Pharmaceuticals. So Riza, we did speak about competition, right? And in the pharmaceutical industry, I'm sure there's competition all around us. Can you just tell me your brand value from Slim? What y'all have to offer to your clients and persuade them to choose y'all?
Good question. Competition is there everywhere. But when it comes to pharmaceuticals, we are treating patients. In Slim Pharmaceuticals, we represent one of the leading pharmaceutical companies in the world, especially the multinationals like Otsuka, Baxter, and Roche. So what our chairman's vision is to provide accessibility to economical drugs, not that expensive drug like biosimilars. So competition is there everywhere, but we have to understand we are looking after the patients. We are treating this to the patients. So identifying the patient pool, identifying our product where we can fit in, and getting down highly accredited company manufacturing products, that itself gives us an edge over the competition. And also, we always go into niche markets, orphan drugs, where there's no much of competition is available. But there is a patient pool who is in need. So we cannot only see business, we have to see the patient centricity also. So we look into both those two angles and we are moving forward.
Yes. Can you just give me an idea about the working culture in terms of training, the workforce that y'all have? When y'all do have a problem, how do y'all come upon it in terms of labor at Slim?
Yeah. It's a good question. We have more than 150 plus employees working with us, and we have more than 70 field staff working with us. And we have a very good HR unit, and we have identified and we had done the exact mapping of each and every employee that we have. We had done the mapping and we had done the profiling of the employees we have, and we have specifically, we have designed them industry-related trainings. So because industry-related training is very important, especially the language, the industry-related language, industry-related vocabulary. Unlike the other field, we are dealing with high-tech healthcare profession consultants. So we had to talk to them in that language. So we have a very nicely set up unit with us, and they continuously do the trainings as per the industry. And also the second question you asked, attrition rate is something, it's very common everywhere, the turnover, staff turnover. So in marketing, it's almost a double digit. So it's our duty to make this particular field more lucrative and more pristine and more noble to more people to come and join with us. So that's what we are trying to do, trying to build the goodwill, give the training, give them the confidence. Thank you.
Yes. Now we know that AI is all around us, right? How has digitalization and in terms of AI shaped the pharmaceutical industry?
Very good question. Amazingly, globally, the entire pharmaceutical company is getting into AI now.
Yes.
And as you know, the diagnosis factor, especially in the healthcare profession. But when it comes to identifying patient pools, identifying funnels, helping our healthcare profession to shape up the market, AI is extensively used. And we are also getting to the AI. We are helping a lot of healthcare professions, a lot of pharmaceutical body, a lot of colleges in Sri Lanka to identify patient pool using the AI. So I always tend to say the future is AI and innovation. So pharmaceutical company, I think, is in the forefront of that.
That's true. Now, with the playing of AI, do you think that's going to lose jobs for those who hold jobs?
Very unlikely. In pharmaceutical company, human touch is very important. And also, AI is something that will really facilitate the doctor to identify maybe a specific disease, maybe what is there to come in future, and maybe how the market behaves, how his patient pool behaves. So it gives him a very specific look at the future, how the market is going to happen, how his patient pool is going to change. So that actually people are not going to lose jobs. I think people are going to be more sharper and more specific. And it is going to help the healthcare profession to treat their patients in a more optimized way.
Okay. So what I've understood is that Slim Pharmaceuticals really has a global standard, right? But having this global standard, how do you all localize it to the Sri Lankan community?
Exactly. I think globally, Sri Lankan pharmaceutical industry has to follow the global standards as well as the local standards. So what is more stricter has to be adhered to. So we are genuinely a Sri Lankan company. My chairman is a Sri Lankan. He's come up in a very long way, and we are into private business, we are into tender business. So he's 100% Sri Lankan. So we know the pulse of the Sri Lankan people, and we know where to pitch exactly. But as I always said, we need the international flavor also. We need that. If you go to other countries, how the product managers have improved themselves, how do they look at the business. We need to adopt those cultures in Sri Lanka because we are growing in Sri Lanka. In 5 years, 10 years time, we had to be there. Otherwise, we can't compete this market. We can't be going this using our conventional wisdoms. We have to change.
Yes.
So I would say we have got the international flavor of it.
Yes. So you started small and now you're a giant in the pharmaceutical industry. You are the CEO of a reputed company. Can you just tell me a defining moment in your process of your career?
Basically, I think winning the international awards. That is number one. Then I realized our potential is as equal as the global potential.
Yes.
And then we realized, although the big countries like India, China are big, we are also big.
Yeah.
We also can do. We also having our integrities and we also have our knowledge. That is number one. And number two was actually becoming a CEO in the month of September. That is one of my biggest dreams. And I never had that dream of becoming a CEO actually. Yes. And so it was a real turning point in my life and very hot seat, as you know. So I'm eagerly waiting to perform in that.
And I'm sure there are many like-minded individuals who want to know or get into the pharmaceutical industry. Is there any advice that you would give them?
Exactly. Now we find out for our interviews a lot of basic degree holders like the BSc Science and also Biomedical Science. A lot of people are applying. Actually, it's great because there is so much of scope that is available in the pharma industry. You can be a medical delegate, you can be a a field manager, you can be a product manager, you can be a clinical service liaison officer, you can be a medical service liaison officer, you can be a pharmacy service liaison officer. And also the support services. We have the demand planning, inventory control, tender division, and we have a massive regulatory division, HR division. So if you see the scope of the pharma industry is not related only for the delegates, only for the medical delegates or the sales delegates. The scope is immense because as an industry, especially the slim pharma, what we do is anybody who joins, they'll be properly trained. They'll be taken forward. So it doesn't mean that you have to join for a company that is their core business. Your education is your core business. It doesn't matter. When it comes to pharmaceuticals, like slim pharmaceuticals, we are there to develop people. So I would always advise the young people, young generation, this is a very lucrative field. And also it's a pristine and a noble field where you can help more people. So I would suggest, I think, in the future, this is one of the fields that Gen Z has to look into.
So the pharmaceutical industry or the field is very vital. Like we can't play around with it, right? So how do you manage to maintain both your integrity and as well as your responsibility in order to strive for success?
It's a good question to reply. As I would say, basically, the local industry now has a 4% growth, year-on-year growth, and a CAGR of 2.2%. That means that by 2029, the market will be around 713 billion. So, in any case, while you're adhered to the compliance, and at the same time, you have to look into the top line also. Top line is very important. So, giving a target in pharmaceutical is not unethical, because what we are looking at in pharmaceutical is the patient pool. How can you treat if there are 100,000 patient pool? We are trying to get maybe 10,000 patients out of that. So it doesn't mean that's an unreachable target. It's a target where we are given is basically the funnel or the number of patients they are available. So it's not unethical. So while keeping in mind the ethical part, the top line also has to come. So it's not easy, but it's possible. And as a company of this nature, that's what, otherwise we can have 100% growth, but we are not going to have. We are very much concerned about the ethicality and the marketing part. So that's what we are growing in a steady pace.
It is no secret that our country is finding it hard economically. With the inflation prices have also risen. How does that affect your industry, and how do you all see a future?
Great. Now, if you see, most of the slim pharmaceutical products we bring from Turkey. Now, Turkey is a European country where EU GMP certified manufacturers are there. If you compare the prices of Turkey with the India, it's almost the same. It's almost the same. So, two things. We had to give the patients a quality drug, and we had to give it at an economical price as well. Because some of the diseases are chronic care diseases. So they had to continue for a long time. So it cannot be expensive. It can be affordable. So as you know, third world countries, most of the parents are dependent on the children.
Yes.
So definitely, Gina, we have to bring drugs that can be affordable for them. Even the CEO wants to take to ex-doctor, even the lowest person wants to take his mother to ex-doctor. So we have to have drugs that are very economical as well as quality. So for your question, I think even if you bring a drug from India or maybe a Turkey like we bring at the moment, it's the quality that the patient gets. So by getting a drug from Europe like Turkey doesn't mean that the price is high. Sometimes Indian prices are high.
Yes. I did learn a lot about pharmaceuticals today, and I'm sure you did too. We were in conversation with Riza Cassim, the CEO of Slim Pharmaceuticals, and like I said, we entrepreneurs are doers, believers, and builders. He started small, and he's a giant in the pharmaceutical industry today. Thank you so much for being on the show. We really appreciate it. So please share your thoughts and feedback with us through feedback.adncenglish@derana.lk or via WhatsApp at 076-805-7933. We will see you again next episode on Business Best.